Hello, everyone. This is Dr. Pritpal Singh. And as per the new CBME curriculum that has been introduced recently in 2019, today I'll be taking up one of the components of the competency PH1.34, where we talk about emetics and antiemetic drugs. So, in this particular topic, I would be discussing about what are the various types of what is the basic pathophysiology of emetics, antiemetics, what are the types of antiemetic drugs, and maybe few drugs with a clinical rationale why these particular drugs are used. So we'll start with this particular presentation with these particular aspects, and I hope I am able to clear some amount of doubts on this particular aspect of emetics and antiemetics. And supposedly, if you have any queries or doubts further beyond what I have told you today, you could always get back to me. You could write down to me, and I'll definitely get back to you. So let's start with the mechanism with the emetics, antiemetics, where the competency says that you should know the types, the mechanism of action, the uses, the adverse effects, the indications, and contraindications of antiemetic drugs. So before we start with the emetic and antiemetic drugs, what we need to know is the pathway for emesis. What are the various factors that can trigger emesis? So emesis, all of you know that there's a vomiting center that is located in the medulla, and this particular vomiting center is receives stimuli from many areas. The first of them is it receives stimuli from the cerebral cortex, where we a sense of smell, sight, or thought leads to anticipatory emesis. Then we have the chemoreceptor trigger zone, which is located outside the blood-brain barrier, where cancer chemotherapy agents tend to act or opioids act, leading to uh, stimulation of this particular center. Further communicates this to vomiting center, leading to stimulation. Then we have some centers located in the vestibular nuclei, which tend to be stimulated specifically when we are going through some high travel, maybe a sea travel or mountain travel. We tend to have motion sickness that is due to the stimulation of vestibular nuclei. And then we have the stimuli that is present in the pharynx and GIT, where it could be due to chemotherapy, radiotherapy, or gastroenteritis. And even one of the common factors that is there is even sometimes gag reflex tends to induce nausea and vomiting. Now, let's see what are the various receptors that are stimulated for this. So our therapy would depend upon blocking these receptors. So when our vomiting center has muscarinic receptors, serotonin receptors, the histaminic receptors, which are stimulated, and our drugs then act on these receptors. They block these receptors, thereby acting as an antiemetic drug. In the chemoreceptor trigger zone, we have the dopamine receptors, the serotonin receptors, and the opioid receptors. We have the muscarinic and histaminic receptors in the vestibular nuclei. We have the serotonin receptors that are present in the pharynx and GIT. So before we go into a situation where we would like to talk about what are the drugs that are used for prevention of nausea and vomiting, we should first have a brief idea on situations where we tend to induce emesis. And one of these situations where we tend to use emesis is in the case of poisoning. Because in the case of poisoning, what we would like to have is we would like to have in this poisoning, we would like to have a situation where we would uh, try to induce nausea and vomiting, so that any amount of poison that is there in the stomach can be eliminated from the body. So the substances that are generally used for these two are either apomorphine or it is epicuana. Apomorphine, it acts on the chemoreceptor trigger zone, is a morphine type of morphine derivative, and this particular drug could be given either intramuscularly or subcutaneous. Epicuana is another drug which can be given orally, although there are certain contraindications in cases of inducing emesis, and these contraindications include the acid or alkali poisoning. It includes the CNS. It includes the CNS stimulant poisoning. It includes kerosene poisoning or an unconscious patient. Obviously, in unconscious patient, there is all chances that it could lead to aspiration pneumonia. Same is true for kerosene poisoning. And even in a case of CNS stimulant poisoning, because there are certain, when we tend to induce nausea and vomiting because of this particular factor, there is all possibility that you could lead to severe injury, could lead to perforation in the gastrointestinal tract. Now let's talk about the antiemetic drugs that are used. Now these antiemetic drugs would depend upon the type of receptors that we had been talking right in the beginning. These could be the prokinetics, it could be the antihistaminics and anticholinergics, it could be the neuroleptic drugs, it could be the 5-HT3 antagonists, it could be the 5-HT3 antagonists, or it could be cannabinoids. So in prokinetic agents, we have two drugs that are most commonly used, that is metoclopramide and domperidone. Antihistaminic anticholinergic drugs include mostly the first generation antihistaminic drugs such as dimenhydrinate, diphenhydramine, promethazine, and even we tend to use hyoscine. Neuroleptics, we have the antipsychotic drugs because they are dopamine antagonists. We already talked about dopamine receptors being present in the chemoreceptor trigger zone, thereby stimulating the chemoreceptor trigger zone, inducing nausea and vomiting. And we have the 5-HT3 antagonists such as ondansetron, granisetron, and dolisetron. And obviously, we have another group of drugs that is there, that is cannabinoids. Now, talking about the prokinetic agents, now these prokinetic agents, they tend to block the dopamine receptors that are present in the chemoreceptor trigger zone. Plus, along with being a dopamine receptor antagonist, these drugs are also serotonin agonists. They are serotonin agonists at the 5-HT4 type of receptors, and this causes where in the GIT causes cholinergic smooth muscle stimulation. Now, these drugs are generally used because they are, when we talk about causing smooth muscle stimulation, what it does is it tends to fasten or hasten gastric emptying. So that is why they are labeled as prokinetic agents. Now, these particular drugs, they are used for gastroesophageal reflux disease, then in a situation where there is impaired gastric emptying, in a non-ulcerative dyspepsia, as well as in vomiting and postpartum lactation. Now, there is a difference between these two drugs, metoclopramide and domperidone. Metoclopramide, it can cross the blood-brain barrier, whereas domperidone cannot. So what is the implication of this? The implication of this particular thing is that metoclopramide is a dopamine antagonist, and being a dopamine antagonist, if it crosses the blood-brain barrier, there is all possibility of extrapyramidal side effects that are associated with this particular drug. Now, these extrapyramidal side effects are quite similar to the extrapyramidal side effects that are seen with antipsychotic drugs, which we would be discussing when we talk about the antipsychotic drug. It also causes various CNS symptoms such as restlessness, drowsiness, and insomnia. And being a dopamine antagonist, it also tends to elevate the prolactin levels. So now let's see whether you can answer this particular question or not. Which is a better antiemetic, metoclopramide or domperidone? Now the answer out here would be obviously we want a drug that should act on the chemoreceptor trigger zone. This chemoreceptor trigger zone is situated outside the blood-brain barrier. So we would like to have a drug which does not cross the blood-brain barrier, so that the dopamine antagonist action is not there. So metoclopramide being a drug that can cross the blood-brain barrier, we would tend to prefer domperidone for the cases of as a prokinetic agents for nausea and vomiting. Now we talk about these neuroleptic agents, which are obviously related to metoclopramide, the drugs that we have talked about. Now these neuroleptic agents, they tend to have they tend to have a dopaminergic antagonist action, a muscarinic anti-muscarinic effect, antihistaminic effect, and that obviously tends to help them use as a drug for nausea and vomiting. So these particular drugs are used for post-operative nausea and vomiting. It could be combined with opioids, because opioids, when we have told, opioids are one particular drugs which directly stimulate the chemoreceptor trigger zone, thereby inducing nausea and vomiting. Or it could be used as a drug for neuroleptic analgesia, where we could use it for various surgical and endoscopic procedures. It is already combined with an opioid such as fentanyl, romafentan, or sufentanil. Now, these drugs have certain problems, certain adverse effects associated with these drugs. These drugs, they tend to cause extrapyramidal side effects, as well as there is all possibility that this particular drug could also lead to prolongation of the QT interval. The one of the drugs that are considered best alternative for taking care of nausea and vomiting is the 5-HT3 antagonist, where we have ondansetron, granisetron, and dolisetron. Now, these particular drugs, they tend to act as a 5-HT3 receptor antagonist, and they tend to act on the vomiting center that is located in the medulla, in the chemoreceptor trigger zone, and in the receptors that are present in the pharynx and GIT. And what it does is it prevents the emesis that is induced due to vagal stimulation and chemotherapy. So how do we tend to use it? We tend to use these particular drugs for nausea and vomiting because this particular drug is given 30 minutes prior to chemotherapy, and it could also be used for post-operative and post-radiation nausea and vomiting. Though it has certain side effects or adverse effects associated with these particular group of drugs, but these adverse effects are not so significant that they can deter the patient from taking the drug. Some of the frequent side effects encountered with this particular drug are headache, dizziness, and constipation. Then we have this particular group of drugs, that is the antihistaminic drugs. They tend to act first generation antihistaminic drugs. They are we have the histamine receptors that are present in the vestibular nuclei where they tend to act on this. And the drugs that are available are meclizine, cyclizine, dimenhydrinate, and diphenhydramine. Promethazine has invariably been used in pregnancy for pregnancy induced nausea and vomiting, and it has also been used by NASA for space motion sickness. Now, these drugs, they have a weak antiemetic action, but they are most effective drugs for motion sickness, because when we talked about the types of receptors that are present, I told you that there are these receptors that are present in the vestibular nuclei. We have the histaminic receptors and the muscarinic receptors. So there, this particular drug is quite effective. It could be used in pregnancy, as highlighted in the previous slide. We were talking about promethazine, which can be used in pregnancy. And we have scopolamine or hyoscine, which can be used as, or is most frequently used as, a transdermal patch for motion sickness, where this patch is applied behind the ear around 30 minutes prior to the start of journey. We have certain other groups of drugs that are being used, which we talked about. One of them is the cannabinoids. We have dronabinol, which is used as adjuvant for chemotherapy-induced vomiting, but it is a psychoactive substance, and it always has the possibility of causing euphoria, dysphoria, sedation, hallucination, dry mouth, and increased appetite. And another drug in this particular cannabinoid category is Nabilon, so cautious is advised in this. And we have neurokinin receptor antagonist, which is aprepitant, which is a NK1 antagonist, and this is used along with serotonin antagonist and corticosteroids for chemotherapy induced or chemotherapy onset nausea and vomiting. The adverse effects associated with these particular drugs are fatigue, dizziness, and diarrhea. These drugs being the recent newer drugs, not much data is available on them, and they are generally kept as reserved drugs. So the drug that is most commonly used when we talk about the topic for um, uh, emesis, a topic such as vomiting, the drug that is most commonly used is the 5-HT3 antagonist, which tend to include the ondansetron, granisetron, dolosetron, and we have hyoscine, which is used for motion sickness. Obviously, for other sickness, we can use dopamine antagonists such as metoclopramide or uh, domperidone. Domperidone obviously is preferred because it does not cross the blood-brain barrier. It has fewer extrapyramidal side effects. And these both metoclopramide and domperidone, they tend to also hasten the gastric emptying, thereby they are used as prokinetic agents. So this is in short all about the antiemetic drugs and the utility of emesis, in which is as per the new curriculum that has been introduced. I hope I have been able to clear some air on this particular aspect. And if there are any queries or any questions related to this, I would be happy to hear from you and sort them out. Thank you for your patient listening, and have a nice day ahead.